Good afternoon, Dr. Cassis here. Today we're going to talk about glaucoma. So January is Glaucoma Awareness Month, and I'm just going to go over a few risk factors and how the disease works and what can be done to save your sight. So glaucoma is what we call the silent thief of sight, and the reason why we call it that is because there's no symptoms that are associated with glaucoma unless your pressure is extremely high and your eye is painful. So basically what happens is if the pressure inside the eye, so there's our eye sideways here, our digital eye. So the front part of the cornea, the front part of the eye is called the cornea, the color part is called the iris, and then inside here is the lens. So what happens in a normal eye is fluid is produced and sort of drains out of the eye, bringing nutrients and keeping the eye healthy. So when there's too much fluid being produced or not enough that drains out, the pressure will build inside the eye and damage the back of the eye here, where the optic nerve is located, and that's the definition for glaucoma. That's the simple definition for glaucoma. There's a lot of different type. When the drainage area is very narrow, it's called closed angle glaucoma. There's pigmentary glaucoma, there's congenital glaucoma, so there's all kinds of glaucoma, but the most common one is called open angle glaucoma. So what we want to do is make sure that the pressure is not too high to cause damage on the optic nerve. So the pressure levels normally are between 10 and 21. So when you come in, that's one of the tests that we do. We go ahead and check your pressure. If the pressure is higher than 21, then you become a little suspicious, right? The other thing we're going to do is take a good look at the back of the eye where the optic nerve is located and look at the appearance of the optic nerve and make sure that the opening of the optic nerve is not too big. Again, anything where the opening is bigger than 50% of the optic nerve, we call it suspicious. Then we look at other risk factors like your age, your family history, and your race. So we know anybody above 40 is at a greater risk of having glaucoma. We know people with a family history, and we're talking about siblings and mother, father. And then we also know that African Americans and Hispanics are also at an increased risk for glaucoma. So to come in for a regular eye exam, get the pressure checked, take a look at the back of the eye where the optic nerve is located to make sure everything is good. If we think that there is reason to be concerned, either, like I said, the pressure is high or your optic nerve looks suspicious, then we bring you back for additional testing. And in those testing, we're going to measure the thickness of your optic nerve compared to a normal database and see if your optic nerve is thinner than the norm. And then we also measure the function of your optic nerve. And so the way we do that, so you can still read the chart and have glaucoma. It's not going to affect your central vision until you've lost a significant amount of vision. So we want to catch it before that and lower the pressure before that happens. So what's going to happen is as the pressure stays high and sort of damage or thins out the optic nerve, it's going to cause some vision loss, right, on the peripheral part of your vision most commonly. So that's when we do something that's called the visual field test, where we actually measure the function of your optic nerve. You're sitting in front of this bowl and there's different lights of different intensity that comes on, and you click the button when you see the light. And that we can sort of map what your field of vision looks like and see if there's any areas that are affected. So that's the main way to sort of diagnose and do the screening test for glaucoma. Treatment, the most common way to treat glaucoma is to use eye drops. And those eye drops, for the main part, there's a lot of different eye drops. It's just medicine and medications have come a long way. Most commonly what's used is 1 drop before bedtime, and that lowers the amount of fluid that the eye is producing to lower the overall pressure inside the eye. So eye drops are very commonly used. You can have 1, 2, 3 eye drops depending on how difficult it is to bring down the pressure within the eye. The other very common alternative is to use laser. So what happens with the laser is we're going to open up the drainage area with the laser to allow more fluid to leave the eye, and then for that pressure to come down. Patients that don't like eye drops can actually go to laser as a first line of treatment rather than using drops to lower the pressure. And then if those two things don't work, then there's other more advanced surgical options that can be done to really, the whole goal again is to lower the pressure to keep that optic nerve intact. So if you have any questions, please feel free to call us at 596-4018 and schedule your appointment, get your pressure checked, and get your optic nerve looked at. Thank you.